good afternoon, everyone, and good morning to our West Coast friends who are joining us. Thank you so much for joining today's webinar. My name is Elizabeth Jordan, and I direct Policy Communications at Child Trends, which serves as a hub for the Early Childhood Data Collaborative. Today, we're looking forward to unpacking some of the great work in states to use integrated data to answer critical policy questions on early childhood. So we've got a really great panel lined up today to talk about their work, and are so grateful that you took the time to join us. So our presenters are really the folks on the ground who are doing this work on a daily basis. We're going to kick off with Carlise King, who's the Executive Director of the Early Childhood Data Collaborative. She's going to help orient us to the wonderful world of integrating early childhood data. And then we'll move into talking with our three state representatives. We've got Stephanie from Minnesota, Ben who's joining us from Mississippi, and Leanne from Rhode Island. First up in our agenda is to share some background information with you on the demonstration projects that folks in these sites have been working on, aimed at integrating early childhood data. Then we're excited to share some findings from a recent report that the ECDC just released, and hopefully that'll ground you in some of the lessons learned across these three sites. And then the bulk of this webinar is the chance for you to hear from these panelists. They're going to walk you through some of their successes and their challenges and the next steps they have in their efforts to integrate and use early childhood data in their work. And as Megan mentioned at the beginning, just as a logistical note, do please feel free to send questions throughout the webinar. We'll be keeping an eye on them, and we've got plenty of time reserved at the end for us to ask questions to our panelists. It's also really helpful if you have a clarifying question to send that along as we go. We're happy to just pause and make sure everyone's on the same page and knows what we're talking about. So I'm happy to pass the webinar over now to Carlise King.
Thank you, Beth. So as Beth mentioned, before she talks about our new report and the goals of this project, I'd like to share some information about the Early Childhood Data Collaborative to explain how this work aligns with our mission. So the Early Childhood Data Collaborative was established in 2009 with the mission of promoting both policies and practices that support the development and use of coordinated longitudinal early childhood data. Our primary goal is to transform existing data systems that have traditionally been used to comply with funding reporting requirements into improvement-driven data systems, generating data that can be used to guide decision-making as well as inform policies at all levels. Our vision is that key decision makers have access to comprehensive data on all early childhood investments so that leaders can identify gaps and track progress. Making data available to stakeholders will support policy efforts to provide equitable access to high-quality early care and education programs, to build the supply of high-quality programs by addressing workforce development needs, as well as to ultimately create systems and services which promote the positive development of our most vulnerable children. Having comprehensive data about early childhood investment also informs equity policy concerns related to which children have access to high-quality programs. For example, issues related to preschool expulsion or access to training opportunities for all early learning professionals. Next slide. Part of our work is communicating what it means to integrate data and why having data about children from birth is so critical. The right interventions at the right time have the potential to change a child's learning trajectory, resulting in positive health, learning, and economic outcomes later in life. Gaps in children's learning and development appear well before kindergarten and continue to grow over time. So to support children's optimal development, policymakers, teachers, and parents need timely and accurate data about children's needs to implement appropriate interventions and supports. It's critical because what we do and do not do to support children's early has consequences for what additional supports they may need later in life. But the challenge that a lot of states face is that the data about children served by early childhood programs are disconnected or not collected in a way that allows them to look at trends over time. But the good news is that this is changing in states. This graphic shows 6 early childhood programs that ECDC, go back to the previous slide, This
Sorry about
graphic
that,
shows,
Beth.
no, that's okay. This graphic shows 6 early childhood programs ECDC focuses on in surveys that we've done of states to measure states' capacity to integrate early childhood data and other supports for children across health, education, and social services. You'll see at the top, programs that we focus on include home visiting and Head Start, which offer an array of services for pregnant mothers and children through birth 8. Early intervention and preschool special education, which serves children birth through 5 experiencing developmental delays. State pre-kindergarten, which is targeted or universal in states for children 3 to 5. And then the last program we focus on is subsidized childcare funded through the Child Care Development Block Grant. These child care assistance programs provide financial support to families to access child care services for children from birth to 13. Around the graphic, you see health and education and social services to illustrate when data are linked across all of these early childhood services, policymakers can gain a complete picture of children's early learning experiences. On the next slide, I'll share a snapshot of where states are in being able to link data about early childhood services. So I'm not going to go into detail about this slide, but I did want to make sure that you guys were aware of a recent survey ECDC did in April of 2018 that was released in September, where we surveyed 50 states about their capacity to link child-level data with health, social services, and other education databases, as well as their capacity to link information around early childhood programs and their staff. This chart shows the number of states in blue that reported having the capacity to link child-level data across services, as well as with workforce and program data. You can see from this chart the majority of states currently linking or planning to link, which is in orange. There were 19 states that reported developing early childhood integrated data systems, which were specifically used to bring together these data and to inform policy and planning in their state. If you would like to access more information about the results from our survey or information about your state, you can access the full report as well as your state profile at ecedata.org. But for our presentation today, because a number of states are developing these systems, ECDC has been working to document how these data systems can and are being used by state leaders. I'm now going to turn the presentation over to Beth to talk more about our new report and the work of our other presenters. Beth?
Great, thanks so much, Carly. So in 2016, the ECDC, the Early Childhood Data Collaborative, partnered with the Annie E. Casey Foundation to develop a project that provided funds to Kids Count grantees, specifically so that they could partner with their state agencies to use integrated data to address a pressing early care and education policy issue within their states. And so this partnership gave us the chance to work with folks on the ground to help them build their capacity to answer questions that were relevant to policy issues happening right then and there. So the goals for our project were really threefold. The first was to demonstrate the types of policy questions that can be answered and to get people excited about the types of questions that you can answer with integrated data. The next was to understand barriers that might exist to accessing and to using the types of data that you need to have in place to do integrated data for research purposes. So, what is it that states were struggling with? What challenges did they see? And how did they overcome those challenges? And finally, and really what we're so excited to talk about today on this webinar and have you all be a part of, is that sharing these stories is such an important part of this work. It's a chance to promote changes that are needed to develop integrated systems in other states as well. So the work didn't just begin and end with our 3-stage feature today. We're really hopeful that all of you will be able to take some of these lessons learned and incorporate them into your work as well. So in order to make all of this happen, with the support of the Annie E. Casey Foundation and with a wonderful staff at the National Kids Count Office, we requested applications from state grantees to describe that policy question that they really wanted to answer and tell us why. And in just a minute or two, you will get to hear 3 examples of those states. But what we wanted to understand was what integrated data were needed to answer these questions. And applicants had to demonstrate that their state had an existing integrated data system or that some process was in place in their state that could be used to integrate early childhood data. So we're focused in on, for the purposes of this demonstration project, focusing on states that have a history of data sharing, have something in place already that can help facilitate this. And finally, applicants for the project had to share how they plan to partner with their state leaders to share their final research project and the results, basically what they learned through this process about young children, about that pressing policy question. So drum roll, please. The states that were a part of this demonstration project were the Rhode Island Kids Count, and they looked at connecting their early childhood data with their child welfare data. The Children's Defense Fund of Minnesota, that looked at connecting early care and education data with public assistance, specifically TANF and SNAP. And Mississippi State University's Social Science Research Center, which looked at connecting early childhood data with Medicaid data. So in addition to just this diversity of topics, it's really interesting to note, and I think this will come across even more clearly as each panelist speaks, how differently situated their early care and education data integration efforts were. So if we think of integrating early childhood data across a continuum, they're each at really different stages and have different relationships in place and different challenges that they face. And it was really our pleasure as the ECDC to provide technical assistance and support to these folks as they went through their project. And in addition to just providing technical assistance, we also monitored what they did and their successes and their challenges to help identify what stories from their work we would want to elevate to the field. So taking what we've learned over the course of this 2 years with them, with these three organizations, the Early Childhood Data Collaborative recently released a report that shares some of that. And so we wanted to take just a couple of minutes to make sure that you all learn some of those key findings and help set the stage for the work of the panelists. So first off, I would just want to note that this work was really quite groundbreaking. Even though we selected states that had some type of integrated data system already or some type of infrastructure to support data integration, they were still feeling a lot of challenges that come with starting something innovative. Things like setting up data sharing agreements, building stakeholder interest in integrating the data and in sharing findings, and also translating data for a policy audience who might not be as in the weeds as the researchers and analysts themselves working with the data. Second, we want to highlight how critically important partnerships were in overcoming challenges. So you'll hear from our panelists that several different types of challenges arose over the course of these projects. But in almost every case, solutions were found in the connections and relationships that the Kids Count organizations had. And those came from a variety of places. So it could be relationships within the agency staff themselves, with the analysts who are gathering and running the internal numbers. It could be from partners at the governor's office. It could be from other advocates within the state. Partners from across the spectrum joined in these efforts. And the third key finding to note for you all is that even for the state that had the most advanced early childhood integrated data system, there was still work to be done. And that comes in, adding new data sources and building capacity, but it also comes in sharing the data. Getting stakeholders in the state to use the data regularly, to think of it as an important tool in their toolbox, was such an important step, even for the state that had the capacity really in place. So with all of those findings in mind, we set forth 5 key recommendations in the report. The first is that early childhood integrated data systems really need to include all of the systems that are touching young children's lives. That's health, family, education, public assistance. And when our panelists speak today about the policy questions they chose and why, you will see how much cross-systems interaction there is for young children and their families. The next is to convene leaders across systems, promote brainstorming, goal setting, and discussions. And really, this recommendation comes from that key finding around partnerships. This is an infrastructure that's so important to have in place for problem solving as issues arise. Third is to invest in a data governance structure to guide the work and drive it into the future. This is another piece of partnership. It keeps the work going. It's also really important for protecting the data, making sure it's being used for the right reasons, for the reasons that the different agencies have determined are appropriate, and that data privacy protections are in place. Fourth is to build the time and skills for public agencies to support data integration. It is not a light lift for them to clean the data the right way, to gather the data the right way, and to share it in ways that are protected. And so to ensure that state agencies really do have the capacity to do that important work. And finally, fifth is to keep that work going strong, use the data regularly in programmatic and policy work, and share those successes with the field. So don't let the data and don't let the research findings get buried, but promote and encourage its use. So I want to take just a quick pause here before we move into our panelists. Carly, did any clarifying questions come across that we want to address before we move over to Stephanie?
You know, these are broader. We had a few questions come in, but they're more broader questions. So I will save them for the end, and I'm just responding to people individually.
Wonderful. Thank you. All right, so now the reason why you have all joined this webinar. I'm so excited to introduce each of these three Kids Count organization representatives. And first, we've got Stephanie Hodgenson from Minnesota from the Children's Defense Fund. And Stephanie, I'm going to ask you to share what your research policy question was, to tell us a little bit about why you picked that question, and tell us what you were originally hoping to do with the results.
Great. Well, thanks everyone for joining, and I'm excited to share some of details of our work and our report with you. So as you can see, our policy question was around children of color and low-income children and their participation in public assistance and early childhood education programs. So what it boiled down to is we wanted to see really how some of the most high need children, as well as children who research shows benefit the most from early child and education programs. So that's low-income children, children of color, and American Indian children, how they are actually accessing those programs in our state. And so we wanted to use our early childhood longitudinal data system, which is pretty well developed in Minnesota, to be able to look at data around children of color and American Indian children accessing 4 early childhood programs that were currently included in our early childhood longitudinal data. And then to be able to get at kind of the income and public assistance question, we looked at linked data for our children in our state's TANF program and SNAP program linked with early childhood participation. And those 4 programs, 3 of them are administered by our Department of Education and 1 of them by the Department of Human Services. So we had to use linked data to get at this question. And in Minnesota, our system is pretty robust. It is, we have an online system that if any of you are interested and haven't yet, check out. It's called the Early Childhood Longitudinal Data System, eclds.mn.gov, and it provides all the data in a data tool query system. So all our linked early childhood data, we can actually access on a public website. Anyone can access. So we didn't have to make data requests or anything like that. So that was a huge strength. And later I'll talk about how it did somewhat present a challenge. So why we asked this particular question and needed integrated data to answer it was because we were at a critical moment in early childhood funding. In Minnesota, we had a lot of momentum around early childhood funding at our legislature and our governor level. And so we wanted to provide a report and analysis that lifted up our early childhood integrated data work, while also demonstrating where the needs were for our most at-risk and families and those who also would benefit the most from participation in early childhood programs. So that is why we focused on this policy question and needed to use integrated data to be able to do that.
Thank you, Stephanie. And for folks who might not have caught the website that she was reading for their integrated data system, links to all of those pieces are, if you look on the ecedata.org at our report, you'll be able to find links to Minnesota's data system as well as reports from all of the different projects. Great. Ben, you are up next. So Ben Walker from the Mississippi State University's Social Science Research Center. Ben, I'm going to ask the same questions to you as I asked to Stephanie. Tell us about what your policy research question was, why you chose that question, and what you're originally hoping to do with the results.
Thanks, Beth. So for our project, we were looking at the question of how does early childhood health relate to kindergarten readiness? And so to do this, we linked Medicaid claims data and educational records from the Mississippi Department of Education. And so we were particularly interested in looking at Medicaid's EPSDT program, which for those who don't know, it's like the Medicaid's child wellness screening program and kindergarten readiness data. And so we arrived at this research question by starting with research questions that state agencies were interested in. So our Kids Count director is part of an informal statewide Children's Health Council, which meets regularly and has several of the state agencies in the state. And so it became clear through discussions at this Children's Health Council that agency heads were interested in how their work could align to improve kindergarten readiness and third grade reading. So this project, we started with kindergarten readiness. And in terms of what we were trying to do with the data, I think more than anything, it was just to start by demonstrating the types of questions that you can answer with linked data and to show agency heads the type of policy opportunities that could be addressed using linked data.
Great, thank you. Leanne, I'm going to invite you to go next. So Leanne Barrett is from the Rhode Island Kids Count. And Leanne, again, same question, the policy question, why you chose that question and what you were hoping to do with the results.
Sure, thank you. We at Rhode Island Kids Count have been working on trying to move the integrated data system forward for a number of years, and this was a great opportunity actually for us to try to demonstrate what we could do and what we couldn't do. So we set out with a kind of a big question focused on a population of children with high needs that our Early Learning Council had identified. And those are children who've been maltreated, who are young children under 6, or is what we use for our policy question. We chose that in large part because our Children's Cabinet, our governor, and our Child Welfare Agency director were starting to be more interested in looking at improving participation in early learning programs for kids in foster care or kids who've been maltreated, and most kids who are maltreated are still home with their parents, and they realized learning doesn't start at kindergarten, and they'd always been responsible for making sure kids were enrolled in public school, but wanting to know more about how they can support and promote young children's participation in a variety of early learning programs. So in our state, our early learning programs are spread across 5 different state agencies. So our data, we set out to try to link data across 5 departments using the child welfare population, children who'd been maltreated, as our focus area. And we were also going to look to see if we could get early Head Start and Head Start data, which at the time of this project started was not available in any state data system. So we also worked on trying that, and I can let you know how it turned out in in a future slide.
Wonderful. Well, thanks to the 3 of you for setting the stage that way. I mean, I think folks on the webinar really do get the sense of how grounded these questions are into real policy conversations that were happening in your state. Stephanie, I'm going to pass the webinar back to you now and ask you to tell us about some of the successes in your work, and thinking this is both about the ways that the findings may have influenced policy and practice and public opinion, but also the ways they strengthened your own work and your connections in the field.
Yeah, so I will say I was kind of a newbie to integrated data. So for those of you listening in, if you feel like you're kind of just learning about all this and you're not as well versed as the folks at Child Trends might be, I will say, you know, it can be challenging at first to understand how your state's system works and where they're at and how to explain integrated data, but taking up that challenge was well worth it for us for a variety of reasons. So I will say it allowed us to strengthen and create really a relationship with our Minnesota Department of Education and the staff that are working on our early childhood longitudinal data system, and they were an incredible asset to this work and very welcoming of this possibility, particularly because they had funds to develop and you know, create the tool and integrate the data, but not as much to get the word out about it. So we were able to help them with that. So that was a huge success, building that relationship, which continues. As I mentioned right at the beginning, it of course increased our internal and organizational understanding of integrated data and what's available in our state and what's needed in our state, so we can help advocate for that as an advocacy organization, which has been really great for us. We also were able to use the report and leverage our some of our outreach initiatives. Every year when we release our Kids Count data book, we do what are called Kids Count coffees across the state, and we meet with stakeholders, many of them in the early childhood field or other kind of invested community members, to talk about data and how children are doing. And so we leverage that work to speak about our state's early childhood data system and our report and increase awareness of our state system and the work that we were doing. So that was helpful to the state and to the work of integrating data in our state. And then last, and probably the greatest thing that came out of our work, is that our State Department of Education that administers our tool, our early childhood longitudinal data system online tool, they had some funding to create a data story on the website, and they weren't exactly sure where they were going to go with it, but once we released our report, they decided that the story we told with data around lower income children and children of color and children accessing work support programs and how they accessed early childhood programs was a very relevant story. And so they are basically putting our report onto their website and making it a living report. So they are making a data story within their website that the audience is targeted toward policymakers, early childhood advocates, and early childhood providers and program administrators. And it will feature basically the data and even text pulled directly from our report. And that data will be updated annually. And as the site gets updated and they add more early childhood programs and data features, it will be updated. So our report has become a living web tool targeted at advancing policy solutions and program recommendations.
That is awesome. Congratulations.
Yeah, we are very excited, and I think it's launching shortly here. So.
Oh, that's great. Thank you so much, Stephanie, for sharing all of that with us and for identifying yourself as an integrated data newbie. So I think it's always helpful for folks to know that this isn't just a territory for people who've been conducting research like this for years. It's something that, you know, everyone can benefit from learning about. So thank you for sharing that. I'm going to turn over now to Ben, and Ben from Mississippi. Ben, again, the same question here for you. Tell us about some of the successes in your work.
So from our perspective, I think the biggest success was just simply getting the data and demonstrating what was possible to the state agencies in terms of linking data and promoting the policy opportunities around linking data. And when I talk about the challenges, it'll be more clear why just getting the data was a huge success. And when we presented the work to the agency heads, we found that this work has really strengthened our relationships and stimulated additional questions that we can answer with this data. Also, another thing is that what we found is that we've been able to leverage this work to get additional data. So since we had started this project, we were able to get data from a third state agency, the Mississippi State Department of Health, to take a look at their perinatal high-risk management program and look at how that is related to kindergarten readiness and third grade reading. And so as an organization, I think we've built capacity for doing this kind of work. And so now we have this awesome data, and we can continue to do work with it and answer additional questions.
Great, thank you. And I'm sure there are others on the webinar who strongly identify with that success of getting the data and are looking forward to you speaking to that as your next chance to talk about challenges. So thank you, Ben. And now I'm going to pass the webinar over to Leanne. Again, Leanne, same question. Tell us about some of the successes in this work.
Okay, great. We were successful in partnering with our data intermediary in Rhode Island, DataSpark. That is the organization that integrates data for the state longitudinal data system, SLDS, that the Department of Ed uses from kindergarten up through college and career. And we asked them, this was actually their first time integrating data across early learning programs about child enrollment. And out of those 7 different data sources that I mentioned in the last slide, we were able to get 4. So we got the population of children who were maltreated from our Department of Children, Youth, and Families, our Child Welfare Department. And we got data from early intervention, which is our Part C program. And as some of you on the phone probably know, there is a federal requirement that all kids who are maltreated are supposed to be referred to EI or Part C. So we were glad we got that so we could take a look at how we were doing. And our state pre-K data also came in. And we got some data from the Department of Health on home visiting participation and some risk factors. Although the Department of Health didn't send their data through the data intermediary, but they ran a match directly with the Child Welfare Department. So I have learnings about how challenging it was, which I can share later, about trying to take on such a large project. And one of our issues was there are multiple data intermediaries that are in Rhode Island, but we were really successful in getting at least some analysis done of where kids who'd been maltreated had participated. And we found out some really interesting stuff, that 53% of the kids who had been maltreated had received at least one First Connections home visit, versus the general population in our state is 29%. So we know that they are getting identified and referred early to try to find services for these families who may be more vulnerable. We know that about 10% participated in an evidence-based home visiting program, either before, during, or after the child maltreatment occurred. And that 23% of the child welfare cohort had participated in early intervention, which is almost 4 times higher than the general population of 6%. And we know that kids who've been maltreated are much more likely to have a delay or disability. And we found out that only about 2% of the kids who've been maltreated had participated in pre-K. And that may be related to the fact that our pre-K program is very small. And it's just a program for children age 4, so it's not as big of a program as the others. And we were able to look at the unduplicated data, which showed us that of the kids who were in any of these programs, we had 15 children who were had overlapped and been in more than one program. Those 15 children had participated in EI and in state pre-K. So that we did get some findings which were interesting and usable by our child welfare system to promote participation in early learning and development, and also by the managers of these early learning programs to think about how they could make some changes where they're better able to reach out and enroll families who are have the major risk factor of some indicated child maltreatment. Thanks.
Yeah, that's great. And it's just so exciting to hear some of those concrete, actionable numbers come out of this that you could share. That's great. And I want to flag for folks on the webinar, one of the interesting things that pops up hearing folks talk about their successes, again, it's just that diversity of stages at which their early childhood integrated data efforts had been. So we have, excitement that we're getting some of the data. We have a system already in place that's available to the public. And we have Rhode Island who's, has these data intermediaries and is thinking about integrating data in new ways. So just so folks, as you walk away from this webinar and think about where your state is, there are ways to move this work forward, even at different stages. All right, so Stephanie, I'm going to go back to you again, and I wanted you to share with us some of your greatest challenges completing this work, and also some of the most important things you learned that might help other states who are dealing with that challenge. So, if you were to go back to when you originally applied, knowing what you know now, would you have approached this project or the scope of the question any differently?
Sure. So I think we probably would have kept with the same question, and if we would have had more time, we might have fine-tuned it a little bit more and used some of the more available data within our system. However, I think with the time we had allowed and the kind of messaging we wanted to advance for that legislative session, we were successful in putting together an analysis that increased awareness of the system and the use of the system. However, one of the big challenges that we had and feedback that we had when we presented our analysis to partners and early childhood program administrators and staff was that the data was limited. And we, in our system right now, or when we did the analysis, I should say first, our system only connected to 4 early childhood programs. So our early childhood family education program, which we did find that was highly underused by populations of color and low-income families. Our early childhood special education system, which the analysis found, kind of reflected special ed participation in K-12, but we know that we have disparities in access around special ed, and that if we increased use among the populations we were examining in this program, maybe we could reduce reliance on K-12 special ed. And then district preschool, which we found had a pretty representative sample among the populations we analyzed. And then our child care assistance program, which we found is the program that most serves our low-income children and our children of color in the report. Those were the only 4 programs, so no home visiting data, Head Start data. We have a state-funded early learning scholarship program. That data isn't in the system, so that was some feedback we got, and we knew that the Department of Education was working hard to try their best to include those programs and get those data sharing agreements. And some of that has happened. So we look forward to, as I said, our report kind of being a living feature on their website and starting to integrate some of that data. And then I think the other thing was, it's particularly to the audiences that we were looking at, which were pretty new to integrated data. Some of them are, Head Start directors or project directors within county social service systems. they may know about integrated data, but not fully understand it or see its benefits. So kind of communicating the data was a big challenge and learning curve for us that Child Trends supported us with in many ways. But I think we're still kind of learning how to best talk about this data in a way that is receptive to wide audiences and that people can understand the importance of the data and what it can be used for. So, but the actual findings of our analysis, which you can see in the report, were very beneficial and brought kind of a nuanced way of talking about some of our early childhood programs and ways to make referrals within different systems to make sure if children were entering through one program that they were their families were made aware of access to other programs. And so we wouldn't have changed the question, but we would have, we hope to continue to analyze more data as it gets integrated into our system moving forward.
That's great, thank you. Thanks for sharing that. Ben, you gave us this teaser that challenges were interesting in Mississippi, so we're gonna turn to you for the next slide here.
All right, so our greatest challenge most definitely was dealing with setbacks to our timeline. And so I think in total, it took us about twice as long to complete this work as we originally had budgeted. And so just a useful piece of background is that we did not go through our state ECLDS for this because the specific data that we needed to answer this question required student level data and it required Medicaid data, which our state ECLDS does not have. So that being said, we had to establish data use agreements with both state agencies. And so getting the education data was not a huge challenge because we had already had a data use agreement with the Mississippi State Department of Education through work that we had done as data anchors for the W.K. Kellogg Foundation in Mississippi. And so with Medicaid, you're dealing with sensitive protected health information and data that has to be used in accordance with HIPAA is a special challenge. And so there was multiple steps that we had to go through with the Mississippi Division of Medicaid, starting with the data use agreement, which took some time, but we got that accomplished, and working with not only our institutional review board, but the privacy board at Medicaid to get a HIPAA waiver to do this work. And then, you know, once we had gotten those steps taken care of, we were pretty optimistic that having the data process would be sort of the easy next step. But what we found is that that actually was the greatest challenge. And so once we got to that point, it was clear that it was going to be quite a long time to process this data. So what we had to ultimately do was simplify the data request to get something that was more manageable for the state agency to produce. And so originally we had wanted to look at stuff that spanned a lot of years, looking at, you know, from birth to third grade, and we had to sort of simplify it looking at the few years before children enter kindergarten in terms of their Medicaid claims data. And so I think in retrospect, you know, since we had to change our question, maybe starting with the simpler question to begin with would have been a useful strategy. Another thing that I would mention is that it might have been useful to bring the data folks to the table early on in the conversation, even perhaps when we were negotiating the data use agreements and putting in all the parameters for the type of data that we were getting, because maybe some of this would have come out early on. And so I think, yeah, I think that would have been useful. Thanks.
Thanks for sharing that. I'm going to pass the webinar now over to Leanne. Leanne, tell us what were the greatest challenges you saw in Rhode Island? And you hinted to some of them, but share with us some more.
Well, our biggest challenge was the working with 5 different state agencies, and then we have, we're a small state, but we had 7 Head Start grantees. So we set a very aggressive goal of trying to integrate data across the whole early learning system, which I actually thought would be a lot easier than it was, because we have done a lot of work in our state to think through data systems. And in fact, we have, for our report, we actually counted up 5 different data intermediaries that are available in the state that work with different data sets and match them across departments. But that, I think, actually ended up being a challenge, because there isn't one intermediary that felt like they had responsibility or ownership for the early childhood data. And in fact, the different departments are being asked constantly to give their data to different places. And they are sometimes protective of their data. They don't want their data to be misused or anything like that. So we were able to work really closely with the departments, and we always, when we do our data products, share drafts with them and have them take a look at recommendations and what we found to make sure that we're not misinterpreting things. So our biggest challenge really was that we need to work on governance, and across 5 departments, each department can't decide things separately. That we'd like to have, so we actually put in our report a recommendation that we strongly consider an Office of Early Learning, that we're in our state able to run a bunch of high quality programs separately, and people talk together, and everybody is friendly and nice. But when you get to data sharing, it's a huge challenge. So we think other things would be helped by an Office of Early Learning, but in particular, sharing information so that we could look at unduplicated child enrollment and which kids with high needs are getting services and which kids are not, by combining data. So after we put our report out with that recommendation, we have seen some more interest in figuring out early childhood data governance. There has been a meeting here in our state, and the departments have put in a small amount of money, pooled money, to fund our early care and education data system, which is housed at our Department of Ed. And that system houses information about program data and about the early childhood workforce. And our child enrollment data still needs a lot of work to figure out how that's going to be integrated on a long-term basis. Everybody's very willing to do it for special projects, and this was sort of really seen as a special project by the state. But right now, we don't have like a state leader who is regularly asking for reports on kids who are unduplicated kids. It's interesting with the PDG grants that just came out, that was one of their questions from the feds. So the more people who can sort of demand states be able to produce this data, the better we'll be able to get our systems moving so that we can produce regular reports and not just special projects. And on the positive, another positive thing that came out of it is our Head Start agency. So I think I said we have 7, and now actually we have 6 because 2 of them merged during this project. So we have 6 agencies, and 2 of them are now sharing their data with the health department, and it's being fed into the health department's data system because health department manages home visiting. So that's why they asked for it. But we'll be able, hopefully over time, to be able to include look at that Head Start and early Head Start enrollment when we're looking at which kids are getting what services. So that is in general the story from Rhode Island. Our big learning is really the importance of governance in order to be able to produce these reports on a regular basis.
Great. Thank you, Leanne, and thanks to all 3 of you for, you so clearly share what these challenges were, but you all continue to have enthusiasm for this work and clear next steps. So that's great to see. Charlie, since you're watching our questions now, I think we've got about 10 minutes left. Any questions come through over the question box?
Yes, so just in the interest of time, Leanne, I had 2 clarifying questions for you about your project, if you could answer quickly, and then I have a broad question for everyone. So Leanne, one was, does maltreatment in Rhode Island include neglect? And then the second question, if you could just clarify what you meant by data intermediaries in Rhode Island.
Oh, okay. So yes, child maltreatment, I use that in just because it's easier to say than child abuse and neglect. So it is both. Some kids experience both abuse and neglect, but we know actually, and we included in our report, that the majority of child maltreatment is neglect. It's not physical abuse. And the second question is about data intermediaries. A data intermediary, and Carlise, correct me if I'm wrong, I'm not the national expert on data intermediaries, but I think that I'm using that term to mean an organization or an entity that collects data that has that the information that identifies the name of the child, the date of birth, so the private information about the child, which you need in order to match it. So they got the information from child welfare that said, here are the names of all the children, their birth dates, and some identifying information so that they could then get the data from early intervention, our Part C program, and say, here are all of the children who participated in early intervention over this time period, and the data intermediary has the systems in place to securely match them and produce a report for kids count for me that was aggregated data. So I didn't ever get or see any of the private information about kids, but you need that really, I think, is the purpose of integration, is to be able to have those systems in place to protect privacy, but allow the state to get information that can inform policy decisions about the whole system.
Leanne, I think that's absolutely correct. So I think this goes to Ben's comment too about their challenges. In some states, if they don't have the internal capacity to be able to link or analyze data across the agencies, they may use a data intermediary, which I would define as a non-government agency, but one that has data sharing agreements or has been given the authority or permission to access and then analyze and link on behalf of the state agencies. And this can be a university, it could be a research organization, such as DataSpark in Rhode Island, and it varies. But this is a strategy that states have used in order to be able to translate and use data that they've integrated. So I'll go to the first question. So the first was partly a question and a comment. One was asking about the downsides of not including information on children and families not receiving state or federal supports. So one of our participants had commented in Rome, Vermont, that in efforts to analyze child well-being for children and families in the longitudinal data project that they're doing, they've included some key population data points from health, as well as developmental screening from the Department of Health as well. So they were talking about the importance of emphasizing other data sets that may be needed as part of these analyses that may not be accessible from the state. I don't know if any of the states could give an example of how they used or incorporated population-based data as part of their analyses. One example?
This is Stephanie in Minnesota.
Thanks, Stephanie.
I could have mentioned this earlier, but so I'm glad it got brought up. But it agreed that sometimes it is a challenge. So for us, we use participation and TANF and SNAP as our kind of way of looking at income and participation to early childhood programs. But of course, not all families who are even eligible access those programs, and not all low-income families are eligible for those programs. So I get that it's not a perfect measure by any means. But we did do some analysis in our report using census level data, and we partnered with NECDC to do a deep dive into census data that looked at income requirements and work requirements for CCAP. And then we compared that to participation in CCAP by race and ethnicity. So we were able to find that about 82% of income eligible children in our state weren't accessing child care assistance. And then it was about 73% of income and work eligible weren't accessing the program. And then we did it by age and race and ethnicity, so we could do a deeper dive into some gaps than was just provided in the analysis. And I think we also looked at census participation in preschool programming and research around that to do some comparisons to other states, and we found that Asian children in Minnesota have some of the lowest participation in the country in early childhood programs, and that was reflected in the ECLDS data as well as the census data we looked at. And then Hispanic and Latino children nationally often face barriers to participation too. And so we did look at some census and more broad program participation data to make some comparisons, conclusions, and provide more context for our recommendations.
Thank you. And then I'm going to combine two questions just because I know we're low on time for each of the presenters to address. So I think one of the questions was how, for those that are interested in being able to expand this work in their states, how did you approach sharing this information or communicating this issue to leadership such as the governors or agency heads in your states? And then did you run up against any concerns about being blamed, or their concerns about moving forward with these projects because of concerns about showing poor outcomes based on your questions? So I'll start with Mississippi.
So because of our data use agreements, we have to sort of have meetings to report these findings on the linkage. And in terms of the concern about what the data might show, being sort of in the academic world, I don't think we tend to have much problem with the idea that the data is going to be what it's going to be. So I don't think that was really much of a concern from our end.
Okay, Leanne, did you guys, from your partnership's experience, how did you communicate this project and this work to leaders in your state? And then also, were there any concerns about the potential outcomes of your research question?
Sure. So we have a children's cabinet, which is meets monthly and has the department directors from each of the departments that touch children and families. So the Department of Ed, Human Services, Health, etc. And we presented to them actually soon after we got the project grant, and to let them know that we were going to be working on this report, and we wanted to partner with each of their agencies to the right people to get the data. So that worked well. They were very supportive of it. Our children's cabinet chair actually wrote a letter of support when we applied for the grant, so they wanted us to do it. We didn't get any negative pushback, and then we went back to them after it was done and explained how difficult it was, challenging that we were not able to get all of the data that we wanted. And it did spur a lot of conversation at the Children's Cabinet about how each of them, even though they run agencies, are not able to, this kind of is a higher level, almost governor's level decision, I know the Children's Cabinet Policy Director is working on that. And it's related to the whole, how do you govern early childhood systems in general, and is it at the middle manager level, or getting together and trying to share resources, or there's sometimes things that need a higher level of leadership to make something happen. And like our Commissioner of Education said at one of these meetings, and he said, this is more important than my salary. Like, I'd rather have you spend the money to have integrated data on where kids are in the early childhood years than pay for my salary. I'm sure he didn't mean that, but it was. He tried to explain how important it was to him, and it wasn't something that he could do on his own, and it needed a high level of attention.
Thank you, Leanne. And then Stephanie, and then we're going to close out.
One thing that we did when we initially looked at the data is we brought the data to a coalition that we staff called Voices and Choices for Children, which is a collaboration of early childhood advocates, program administrators, and staff and parents and most of them are people of color, and they serve communities of color in the populations we were talking about. And so we take the same approach kind of to Ben, is like, if the data shows us something that contradicts what we're saying or our initiatives, we should probably take a deeper dive at that and not be afraid to. But we also think we wanted to bring a community perspective to the data and the results we were seeing and how we talked about the data. So before writing the report, we brought our findings and some of the data to this particular group, and they helped us provide context around some of our findings. For instance, early childhood family education, which is more of a parent group education program in Minnesota. They said, it's never worked for populations of color because of the time and where it's located. And, they said, sure, you could modify it, but we would rather see investments in these other programs that do work. So some of that community-based conversation was critical to making sure the data was framed accurately. And speaking of framing, we also used our frameworks work to write the report and talk about it. If people use frameworks, communications, and training, that is something that was really relevant to this work for us.
Well, thank you, everyone. I know we have additional questions, so we'll do best to follow up with our presenters and send those out to you guys afterwards. But I just want to, again, thank everybody for joining, and I'll hand it back to Beth for the last slide.
Great. Yep. Thanks so much. If folks do have questions, feel free to reach out to us. Our website is on this page. You can follow us on Twitter, and Carlisa's contact information is there as well. As you know, we recorded the webinar, and we'll be sure to send that around to folks who registered also. So thanks for joining today, and hope you all have a wonderful Thanksgiving.